My patient once told me I was too smart to be just a nurse. He was wrong about the just, but right that my skills were valuable beyond the bedside. Here's where I found freedom. You know that feeling when someone thinks they're complimenting you, but it feels a bit off? That comment stuck with me for weeks because nursing isn't just anything. It's one of the hardest, most skilled professions out there. But it made me wonder, what else could I do with my clinical knowledge? For years, I thought my options were limited: move up to management, go back to school for years, or keep doing the same role until retirement. But here's what they don't tell you in nursing school or medical training: your understanding of clinical operations is incredibly valuable outside traditional settings. Let me ask you something. Are you missing important family events because of your shift schedule? Are you feeling physically exhausted after every workday? Are you tired of workplace chaos that prevents you from giving the care you know patients deserve? Are you wondering if this is sustainable for the next 10, 20, or 30 years? I was saying yes to all of these things. That's when I discovered digital health, an entire industry where clinical expertise meets technology. Here's what nobody tells clinicians: healthcare technology companies are desperate for people who actually understand healthcare from the inside. Think about it. How can someone build a solution for nurses if they've never been a nurse? How can they create software for doctors if they've never worked in a hospital? That's where your experience becomes priceless. In my first digital health role, I wasn't the technical expert, I was the healthcare expert. I translated between the tech team and the clinical staff. When developers suggest features, I could immediately say, that won't work, because during emergencies, nurses need to dot dot dot, or doctors will never use that because of how rounds are structured. My clinical background wasn't my past, it became my competitive advantage. Let me share some of the roles clinicians are moving into right now: clinical consultant, advising on product development; program manager, overseeing implementation of health tech; analyst, examining healthcare data to improve outcomes; team leader, managing digital health teams; testing specialist, ensuring healthcare solutions are actually working; training coordinator, teaching clinicians to use new technologies. Within 6 months of transitioning, my life transformed completely. I work regular hours. My schedule is predictable. I can plan vacations without begging for time off months in advance. My salary increased by 35% in the first year and then went on. I work from home almost every day. I haven't missed a single one of my family events since forever. But here's what matters most: I'm still helping patients. Actually, I'm helping more patients than ever before. The systems I helped implement are now used by over 200 hospitals worldwide. That's thousands of patients benefiting every single day from my clinical knowledge. Now, let me address the questions I know you're having. Do I need to learn coding? No. Most roles require zero coding. Will I need another degree? Most digital health companies value experience over degrees. What if I'm not tech savvy? Basic computer skills are enough to start. You'll learn as you go. Can I really work remotely? Many positions are 100% remote or hybrid. The transition isn't about becoming a technical wizard overnight. It's about applying your existing expertise in new context. Remember, you already have the hardest part: the clinical knowledge that took years to develop. The technical skills, those can be learned in weeks or maybe months. What's holding most clinicians back isn't ability, it's awareness. They simply don't know these opportunities exist or how to access them. So, that patient who thought I was too smart to be just a nurse, he didn't understand the value of nursing, but he accidentally pushed me towards something important. You can still be a healthcare professional without sacrificing your health, your family time, or your sanity. You don't have to leave healthcare behind. You just need to find a different way to contribute. Your clinical experience isn't just shifts you've survived, it's an asset that's in high demand outside of traditional care settings. If you're feeling burnt out, undervalued, or just curious about other options, I've created a free guide called Digital Health Jobs. That's for clinicians. It breaks down exact roles I see in use every day: the top roles perfect for clinical backgrounds, real salary ranges you can expect, how to translate your experience on your resume. Where to find these job openings? Just click the link in the description or comment roadmap below, and I'll send it to you. Your clinical expertise is worth more than you know. You deserve a career that values both knowledge and your well being. The future of healthcare needs people like you, just not in the way you might have expected. I'm living proof that you can make this change, and I'd be honored to help you do the same.